Hey, what comes to your mind when you hear the name a pressure ulcer, a pressure sore, a decubitus ulcer? Well, my name is Wanjiko Ngare. Welcome to my YouTube channel. If you have not subscribed to this YouTube channel, kindly do so. Remember to hit that like and notification bell for any time we upload a new video. You'll be among the first person to be notified. Let us jump right into today's topic. What is a bed sore? First, we will start by defining it. This is the damage of skin integrity. This can be caused by pressure from bone prominence, insertion of a medical device, and also friction. Let us discuss factors that may lead to pressure sores. First, we have being immobile, a patient staying in one position for a long time without being turned. We can say poor nutrition. You can say loss of neuro issues, e.g. the loss of consciousness. We can say spinal injuries. Another thing is diabetes. Mostly we know that diabetic patients, they have loss in sensory nerves. Due to this patient can step maybe even on a stone, maybe can even stay on a chair and one of their parts is pressed, but they cannot even notice. Another thing is poor nutrition. Let us now discuss the stages of pressure injuries. But before that, we will start by looking at the layer of the skin. The first top layer is called the epidermis, followed by the dermis. We have the capillaries, then we have the subcutaneous or the fatty area, we have muscles, then the bones. One thing to note is that the reason as to why when we said about bone prominence, when this area is, maybe this is your hand, maybe this is your, let us assume your heel. Once that heel is pressed, there will be no blood supply due to this pressure, and that is the reason a pressure sore is formed. Let us now look at the stages. We have stage 1, and this staging is by the National Pressure Injury System. The skin is intact in stage 1 and it is reddish in color. We have stage 2. The skin is not intact, and there is partial loss of the dermis. Then the sore may look pink or red. Then you may have an open or a closed blister. We have stage 3. The skin is visibly damaged. You have full skin loss. Then you may start seeing the fatty area, and the wound edge may start rolling backward. Then you have stage 4. This stage is the skin here is seriously damaged. You can see the bone, you can see the muscle, you have ligaments. Then we have another stage which we call the unstageable. This is whereby the skin may look yellowish, tan, you may even have an eschar. And for those people who don't know what is an eschar, this is a hard area. Then we have full thickness injury. This is another type of pressure injury. Now, as a nurse, you are supposed to do your nursing intervention. What are you supposed to do? First, you have received your patient. The first thing to do is to do a head to toe examination. And the key roles of nursing intervention is to prevent, to detect. Then, if there is this pressure sore, you do wound care. Now, this your patient, you have done your head to toe assessment, and you have found that let us start, but there is no pressure, so you fight to help this patient not to get one. Or if maybe you have found this patient has a pressure sore, you first start by assessing the stage of this pressure sore. If it's something you can manage at the ward level, you can start doing the wound care. But if you notice that this pressure sore is beyond you, you can call the wound care team. You can even invite a plastic surgeon. Then the plan of action. before we do plan of action, we'll love to know the top sites where these pressure areas occur. We have the heel and the ankle, we have the inner knees, also sometimes the outer knees, you have the hips, the sacral region, we have the shoulders, we have the ear, we have the occipital. Those are mostly the top sites where you can find those pressure sores. Now, plan of care. First, you can use barrier creams. These barrier creams you apply on those top sides. These barrier creams are like aqueous cream. You can also have something like zinc and castor. The second thing you can do, ensure the patient's skin is always dry. Either it's at the hospital setup or at the home care setup, ensure that this skin is always dry. Thirdly, you can do 2-hourly tanning. Ensure this patient has not stayed in one position for a long time, so that you can at least help save the skin, or at least you can help maintain the skin integrity. Do 2-hourly tanning. You can use things like Ripple mattress. This mattress helps in distributing this pressure, so there will be no pressure. So another thing, you can use heel pads, you can use elbow pads, you can use gel cushion. And this gel cushion is mainly for patients who may be on, they spend most of their time sitting down, or they sitting maybe on a bed, on the wheelchair. You are recommended to use a gel cushion. Another thing you can do is routinely assessing the skin integrity. And for those people who cannot afford a heel pad, you can take gloves, put some warm water, then you put at the patient's heels. Adios.
Oye, ese maíz. ¿Qué?